Assalamualaikum warahmatullahi ta'ala wabarakatuh. A pleasant day to each and everyone. So in this video, we will discuss the last unit that will be discussed for this Fundamentals of Nursing lecture. So we have here the Unit 8, the Basic Nursing Procedures or the Basic Nursing Intervention. So ito yung mga ilan sa mga procedures na very basic na ginagawa natin sa hospital, sa community, or kung saan mang field tayo ng nursing. Ito yung kasama ng ating final exam. Yung binigay ko sa inyo, di ba, I gave you a task, your final exam, in which gagawa kayo ng PowerPoint presentation on the healthy lifestyle, the nutrition, the fluid and electrolytes, the, ano pa ba to? Nutrition, elimination. So, yun yung mga ilan din sa mga basic nursing procedures na kasama doon. So, I will not discuss those things na binigay ko sa inyo na task kasi I'm hoping na napag-aralan nyo yun kasi you made a report out of it, and I hope na intindihan ninyo while researching regarding those things. Kasi I do believe naman na naituro din siya sa inyong skills kasi yung mga ilan na yon is nadidiscuss, okay? Ilan din sa mga basic nursing procedures na kasama dito is yung temperature regulation or yung pagkuha ng vital signs, which is I think na-discuss na sa inyong health assessment. Okay? Yung pag-transfer ng patient, pag-transport ng patient, ano yung mga skills natin, how to change a patient using with their IVF or IV fluids, okay, paano tayo maglinis, okay, the hygiene, how can we secure the hygiene, the safety of our patients. So I think na-discuss na yun siya sa ating skills. So itong mga nursing procedures na i-discuss ko is somewhat hindi ko nakita sa ating checklist. Okay? As I'm teaching fundamentals of nursing din na skills, hindi ko napansin doon yung medications, the IV fluids, okay, yung pagbibigay ng mga medications, the injection techniques, the different types of IV fluids, okay, and also yung nurse's notes or the proper documentation. Before, long way before, 'di ba? Naituro ko sa inyo yung mga principles of documentation. However, hindi ko masyadong na-clear ano ba yung mga ginagamit natin na mga documentation or uh, ano to, nurses notes na ginagamit natin sa hospital. So, hindi ko siya pahabain later on kasi na-discuss naman din natin yung nursing process, which is yun ang pinaka-importante na malaman ninyo para magkaroon kayo ng magandang documentation. So, let's start first with the medication. So, ano yung mga techniques na pwede natin gamitin when we give medication or yung mga gamot. So, a medication is a substance administered for the diagnosis, for the cure, treatment, or relief of a symptom, or for prevention of disease. In the healthcare context, the words medication and drug are generally used interchangeably. When we talk about medication, okay, magbibigay na po ako ng medication, you give drugs. However, hindi natin masyadong ginagamit yung drugs kasi pag narinig ng mga ibang tao, kasi in layman's term, pag sabihin nating drugs, yan yung mga illegal drugs. They don't know that we use drugs for those legal din na mga medication. So the term drug also has the connotation of an illicitly obtained substance such as heroin, cocaine, and amphetamines. That's why ginagamit natin mostly sa pag nasa hospital tayo is medications or meds. So drug is a chemical substance typically of known structure which when administered to a living organism produces a biological effect. So I don't need to discuss further what is a drug kasi it will be discussed naman in the next year with your pharmacology. So dun yung mapag-aaralan yung mga iba't ibang types of medication, ano yung mga iba't ibang types ng antibacterial, ano yung iba't ibang types ng antiviral, antiprotozoal. Magkakaiba kasi yan ng mga first generation, second generation, third generation. So I hope ma-encounter niyo yan siya for your second year. So medication is a written direction of the written direction for the preparation and administration of a drug is called a prescription. So ito yung tinatawag nating prescription, okay? Doctor's order or prescribed by the doctor. So usually kailangan to siya when it comes to purchasing medications such as antibiotics, kasi dito sa atin bawal na bawal yung pagbibigay ng antibiotics ng walang prescription. However, dito sa Marawi, it is not really practice na humihingi yung mga pharmacist natin ng antibiotic, kasi nga nakasanayan na yung mga Maranaos are so dependent on antibiotics. Kahit may fever lang, antibiotics na agad. So one drug can have as many as 4 kinds of names, such as it's either yung gamot pwedeng in generic name, the trade name or the brand name, the official name or the chemical name. So magkakaiba. 'Di ba paminsan kasi sabi ng doktor, ito yung gamot mo, amlodipine, tapos sasabihin ng patient, ano po yung brand name niya? Sasabihin niya. Tapos pag naiba, bakit magkaiba sila pero hindi nila alam na as a whole, pareho lang yun. Nagkaiba lang sa brand name, generic name, trade name, okay, the official name, and the chemical name. Pag sabihin nating generic name, it is the assigned by the United States adopted names or USAN Council and is used throughout the drug's lifetime. Pag sabihin naman nating trade name or brand name, it is the name given by the drug manufacturer and identifies it as a property of that company. Pag sabihin naman nating official name, it is the name under which a drug is listed in one of the official publications such as the United States Pharmacopoeia. And for the chemical name, it is the name by which a chemical knows it. This name describes the constituent of the drug precisely. Okay? So, yun yung pinagkakaiba ng 4 na names. Pero, pareho lang yun. It is a drug name. So, what are the process of administering medication? Ang pinaka-importante sa lahat is, ito siya, pag-administer na to ha. So, meaning nakapag-prepare na kayo. So, una sa lahat, you need to identify your client. Paano ba nag-identify ng client? By, asking his or her name and looking at her or his, ID band. Okay? So, sasabihin mo, ma'am, sa ngalan ni mo, ma'am, ano pangalan ninyo, ma'am? Taningaran ka? Okay? And then, titingnan niyo sa ID band nila. Okay? So, by the way, may mga situation na in which iba yung sasabihin ng pasyente sa'yo na pangalan niya at iba yung pangalan niya sa hospital. Kasi nga, because of the used PhilHealth. Okay? So, nagkakaroon din talaga yan ng mga ganyang cases. Okay? So, errors can and do occur usually because one client gets a drug intended for another. That is why it is very important that you identify the client. Ma'am, ano pong pangalan ninyo? Kasi pwedeng nangyayari yan na hindi mo tinanong ng maayos, embes na ibibigay mo sa patient A, na ibigay mo sa patient B. One of the Joint Commission's national patient safety goals is to improve the accuracy of client identification. This goal requires a nurse to use at least 2 client identifiers whenever administering medication. Neither identifier can be the client's room number or physical location. So, ang acceptable, hindi pwede yung based sa anong room, saan siya na bed, no? Ang acceptable identifiers natin is the person's name, assigned identification number, telephone number, photograph, or other person-specific identifier. In hospitals, most clients wear some of identification such as wristband with name and hospital identification number. So, yung katanggap-tanggap lang po ng mga identifiers, again, yung pangalan, the identification number, the hospital number, telephone number, photograph, and the person other or as person-specific identifier. So, after identifying the client, next, you will inform the client, ma'am, bibigyan ko po kayo ng gamot. Tatanungin kayo ng pasyente, ma'am, ano po yan? Ito po ay antibiotic para po mawala yung inyong infection sa katawan. So, yun maranaw pa, ma'am, antibiotic kaya para madaso? Bisa. Okay, so it's very important that you inform the client kasi may nangyayari, may instances na pag nagbigay ka ng medication, tapos tatanungin ng doktor, nabigyan ka na ba ng mo? Sasabihin niya ng patay malis siya yung pasyente. Usually, ay wala, ganito. So, i-report ka na nagkaroon ng negligence, ganito, ganyan. So, sasabihin na, hindi ka pumunta doon, hindi ka nabigay. Sabihin ng patient, ganito, ganyan. Kasi, lagi sa atin, customers is always right, which is ang customer natin is our patient. So, if the client is unfamiliar with the medication, the nurse should explain the intended action as well as any side effects or adverse effect that might occur. So, kailangan, we need to educate them. Kasi pwede din maisipan nila na, okay, naalala ko pag wala na sila sa hospital, naalala ko binigyan ako ng ganitong medication, baka maganda siya kasi ginamit to sa akin. So, may mga ganong instances na makakatulong ka din. Then, after that is administer the drug. So, read the MAR carefully and perform the 3 checks. Ito po yung ating 3 checks. So first, read the MAR and remove the medications from the client's drawer. I verify that the client's name and room number match the MAR, okay, or the medication order yan siya. And then compare the label of the medication against the MAR, and then if the dosage does not match the MAR, determine if you need to do the math calculation, and then check the expiration date. The second check, while preparing the medication, look at the medication level and check against the MAR. And the third check, recheck the label on the container against the MAR before returning to its storage place or before giving the medication to the client. Okay, so yan po ang ating 3 checks, okay? While preparing, babasahin mo, okay, kukunin mo sa cabinet ang kanyang medication, ganito, ganyan. Based sa doctor's order o yung sa ticket niya, makikita mo ganito, ganyan. Okay, tingnan mo yung bottle or the vial or the ampule, okay, the same, tama. And then after, first check yan. Second check naman, pag nagkukuha ka na ng medication out of the vial or the ampule, mababasa mo ulit, okay, tama, okay, ganito yung dosage. The third check, before giving the medication or pag ibalik mo na naman yung gamot sa kanyang storage, that will be your third check. So there has been recently a change in what is considered the correct time. Historically, a 30-minute rule or administer medications within 30 minutes before or after the scheduled time was used. Kasi may tendency na sobrang dami ng pasyente mo, kailangan ahead of time or before, siguro, usually 1 hour to, or 30 minutes before ka magbigay ng medication. Example, 8 a.m. magbibigay ka ng medication. Nagpe-prepare ka na ng 7:30 or 7, depende sa dami ng ipe-prepare mo. So, dapat ganun ka. Kasi kung malate ka, example, 8 ka magbibigay, 8 ka pa lang nag-prepare, matapos ka ng 9. So, wala na kasi may medication din na binibigay pag 9 a.m. So, make sure dapat before kayo nagpe-prepare. Okay? So, for next is provide adjunctive interventions as indicated. So, the clients may need help when receiving medications. They may require physical assistance, for instance, in assuming positions for intramuscular injections, or they may need guidance about measures to enhance drug effectiveness and prevent complications such as drinking fluids. Example, usually pag nabibigay ka ng mga oral meds, so pinapaupo mo na maayos yung patient. Okay, so yan yung mga kailangan na ginagawa natin. Then some clients express fear about their medications, and the nurse can relieve fears by listening carefully to the client's concerns and giving correct information. So after naibigay mo na, okay, nakabigay ka ng adjunctive interventions para hindi masyadong matakot yung pasyente mo when you give medication, record the drug administration. Okay, so ano yung gamot na binigay mo? Dapat naka-record yan, dapat nakalagay, given. Tapos, pipirmahan mo yan siya. The facts recorded in the chart in ink or by computer printout are the name of the drug, the dosage, the method of administration, the specific relevant data such as pulse rate taken in the most setting prior to the administration of digitalis and other pertinent information. The record should also include the exact time of administration and the signature of the nurse providing the medication. Again po, hindi example ganito yung nangyari. Dalawa kayo. Divided yung task. Ikaw si charting. Okay? Kayong bahala nagcha-chart ng lahat ng details. And then ikaw si medication. Sabi ng medication nurse, uy, paki-chart naman, pakilagay na nakapirma ako ng ganito, ganyan. Okay, hindi po pwede, di ba? Remember yung ni-discuss ko before, never chart for others or for someone else. Always chart for yourself. Meaning, kung hindi kayo nagbigay ng medication, kung hindi kayo nag-prepare ng medication, do not sign the chart na ikaw ang nagbigay. Sabihin mo sa kaibigan mo or sa partner mo, hala, ikaw ang mag-chart kasi ikaw ang nagbigay, hindi ako. So, ganun dapat ha. Be firm. Kasi may mga instances talaga na pwede kang makasuhan dyan. Kasi pwede maghugas kamay yung medication nurse. Kahit kasi magkakasama kayo sa hospital, hindi natin pagkakaila pag maandya dyan na yung lawsuit eh. Kailangan talaga, hahanap ka ng paraan para malusutan mo yan. Diba? So, kailangan umiwas tayo sa ganyan. That's why we need to be careful. So, medication records are designed so that the nurse signs on the page and initials each medication administered. Often, medications that are given regularly are recorded in a specific or special flow record. So after recording the drug administered, evaluate the client's response to the drug. It's very important na evaluate nyo siya. You check for side effects, adverse effect na pwedeng mag-occur sa inyo patient. Ang pinakaayaw nating mangyari sa pasyente natin is the adverse effect because adverse effect can be complicated na pwedeng mag-cause ng life-threatening effects sa ating patient. Okay? So the kinds of behavior that reflect the action or lack of action of a drug or its untoward effects, both minor and major, are as variable as the purposes of the drugs themselves. Okay, so now let's talk about the 10 rights of medication administration na kailangan nating tandaan. So first one is the right medication. So kailangan ang maibigay nating gamot sa ating pasyente is the medication ordered by the physician. Hindi lang tayo pataka-taka dyan na ibibigay natin sa kanila is yung mga mali-maling medication. That's why you need to identify if the medication is intended for the patient na gusto nyong bigyan. After that, the right dose. Okay? The dose ordered is appropriate for the client. Make sure that you need to if kailangan mong i-calculate, kailangan ayusin niyo yung pagka-calculate ng medication na kailangan ibigay sa ating pasyente. Usually, ang ginagamitan natin talaga ng madiin na calculation is sa mga bata. Kasi we need to take their weight, okay, and then times natin sila, so ganyan, and ginagawa natin. And we need to be careful of that. Okay, after we have the third right, the right time. So we need to give the medication at the right frequency and at the time ordered according to the agency policy. Yun nga sinasabi ko sa inyo na pag may mga medications kayo, may schedule tayo dyan. Usually kasi 8, 9, 10, 11, 12, may mga ganyan. Pero ang pinakamarami is 8, 12, 2 p.m. Okay? Sa morning shift. Now, sa afternoon din, we have 4 p.m., 6 p.m., 8 p.m., and then 10 p.m. So, yung mga ganong medication, we need to take care, we need to be careful na kailangan maibigay natin sila sa tamang frequency kasi nga, binibilang ng doktor. Okay? Hindi dapat na malate tayo sa pagbigay ng medication or ipagpaliban natin kasi nakaligtaan natin, ay sige, next time na lang ibigay ko sa kanya. Hindi po pwede yon. And then, the fourth right is the right route. So, we need to give the medication by the ordered route. Kung IVTT ba, pag sabihin natin IVTT, intravenous through tube, okay, so, papadaan natin sa kanyang dextrose, or IM ba, okay, or a sub-Q ba, okay, kung saan ba sa sub-Q, sa kanyang chan ba, or sa kanyang botox, okay, so, madaming sasabihin lang talaga ng doktor. Pero usually, sa hospital, ang pinaka-accessible na route natin is through tube, sa kanyang pinapadaan sa kanyang tube, and also the oral. And then the next right is the right client. The medication is given to the intended client. Check the client's identification band with each administration of a medication. Again, kahit memorize nyo na po yung pasyente ninyo, you need to check para lang maiwasan natin yung pagkakamali. Wala pong masama sa pagtatanong, ha? Kasi baka isipin ng pasyente, baka isipin ninyo, ay, nahiya ako magtanong, baka kasi sabihin ng pasyente, hindi mo na ba ako na-memorize? Hindi po. Pag sasabihin ng pasyente, paulit-ulit ka, ganito, ganyan. sabihin mo, "Ma'am, we need to be sure po kasi na tama po yung ibibigay naming medication at para sa inyo po talaga yung gamot. Baka po kasi magkamali kami, then kami din po yung papagalitan ninyo." Okay? And then next is the right client education. Kaya nga 'di ba kanina sinabi natin na you need to explain information, you need to inform the patient that you will give certain medications, especially if yung mga gamot na yun is unfamiliar sa kanila. So you need to explain why receiving that medication, what to expect, and any precautions if meron siyang mga hindi magagandang side effects. After the next right is the right documentation. Kaya nga 'di ba, after nating mabigay ng medication, we need to document it. Document medication administration after giving it and not before. Hindi po dahil, sige, nakaschedule na yan na ibibigay ko ganito, ganyan. Hindi mo alam kasi, what if on the 12 noon, intended siya na ibibigay mo, tapos sabi ng doctor, okay, discontinue, tapos gi-chart mo. Oh, di magkakamali ka. And then, pinakaayaw pa naman ni nurse supervisor is may erasure sa chart. So, kawawa ka, di ba? And then next, we have right to refuse. Those adult clients, hindi po kasama dito yung mga minor ha, kasi the minor, kailangan ang magre-refuse is the guardian, okay? Adult clients have the right to refuse any medication. The nurse's role is to ensure that the client is fully informed of the potential consequences of refusal and to communicate the client's refusal to the healthcare provider. So, tatanungin mo, "Ma'am, ganito ha, pag hindi ko po ibibigay, kung ayaw nyo pong mabigyan ko po ito ng gamot, ito po yung mangyayari sa kanya, posibleng mangyari sa kanya. So, ito po, dahil dito, nag-refuse po kayo, so hindi ko po ibibigay yung gamot." So, meron silang right to refuse. However, pag may mga chances na i-demanda ka nila kasi ganito, ganyan, sasabihin mo, "Ma'am, pumirma ka ng consent na you will refuse." Okay? And then we have right assessment. Some medication requires specific assessments prior to administration. May mga medication na, okay, check mo okay, before administration, you need to check the potassium level or the sodium level. Okay? Or check BP when giving medication. Check the heart rate. Ganito. Check the respiratory rate. Kailangan i-assess natin yon. Okay? Huwag lang tayo basta-basta mag-administer dyan ay hindi mo alam kung ano yung vital signs ng patient mo. And then lastly is the right evaluation. Conduct appropriate follow-up. Okay? Was the desired effect achieved or not? Or did the client experience any side effect or adverse effect? Again, yan po ang 10 rights of medication administration na kailangan nating tandaan. We have right medication, right dose, right time, right route, right client education, right documentation, right to refuse, right assessment, and lastly, right evaluation. Tandaan po natin yung 10 right. So we have here the types of drug preparation. Okay? So, ito yung mga types niya. Aerosol or spray or foam. It is a liquid, powder, or foam deposited in thin layer of the skin by air pressure. Such as, yung pang-inhaler, pwede yan siya kasi aerosol spray yan siya. We have aqueous solution, one or more drugs dissolved in water. Example, yung mga acetylcysteine natin, mga mucolytics, okay, powder siya, okay, or tablet siya pero pinapatunaw sa tubig. We have aqueous suspension, one or more drugs finely divided in a liquid such as water. We have caplet, a solid form shaped like capsule, coated and easily swallowed. We have capsule, a gelatinous container to hold the drug in powder, liquid, or oil form. We have also cream, non-greasy, semi-solid preparation used in the skin. We have elixir. It is a sweetened and aromatic solution of alcohol used as a vehicle for medicinal agents. We have extract, a concentrated form of drug made from vegetables or animals. We have gel or jelly, a clear, translucent, semi-solid that liquefies when applied to the skin. We have liniment, a medication mixed with alcohol, oil, or soapy emollient and applied to skin. We have lotion, a medication in liquid suspension applied to the skin. We have lozenge or trouch, a flat, round, or oval preparation that dissolves and releases the drug when held in the mouth. Okay, yan yung mga strep cells, yan, yung mga katulad niyan. We have ointment such as salve or unction. It is a semi-solid preparation of one or more drugs used for application to the skin and mucous membrane. We have paste, okay, a preparation like an ointment but thicker and stiff that penetrates the skin less than the ointment. We have peel, one or more drugs mixed with a cohesive material in oval or round or flattened shape. We have a powder, a finely ground drug or drugs. Some are used internally or externally. We have suppository. Yan po yung ini-insert natin usually sa ating rectum. Okay? It is a jelly type na papasok sa ating rectum. The base dissolves gradually at the body temperature, releasing the drug. We have also syrup. Syempre, alam natin yung syrup, diba? It is a solution of sugar often to disguise unpleasant tasting drugs. The tablet, okay, a drug compressed into small, hard disc. And we have tincture, an alcoholic or water or an alcohol solution prepared from drugs derived from plants. And we have also the patch or transdermal patch, a semi-permeable membrane shaped in the form of disc or patch that contains a drug to be absorbed through the skin over a long period of time. So, example lang natin yung ating nitroglycerin patch na binibigay sa ating mga patient with cardiac problem. Okay, ito naman po yung ating routes ng administration. Okay, pwede pa tayong magbigay through oral, meaning yung sa bibig. Okay, it is the most convenient route and usually least expensive. It is safe, does not break skin barrier, and administration usually does not cause stress. Okay, some new oral medication are designed to rapidly dissolve on the tongue, allowing for faster absorption. For the disadvantage, kayo na po yung magbasa nun, okay? So, yan po yung kanyang mga disadvantage. So, after this oral, meron po din tayo sa sublingual, okay? Hindi lang po kasi sa mouth natin pinapadaan, no? Okay, yung oral kasi daan na inom tayo ng tubig. Ito pong sublingual, hindi po tayo umiinom ng tubig dito. Sa ilalim ng dila natin, dinalagay yung gamot. So, same for as for oral, plus the drug can be administered for the local effect and more potent than the oral route because the drug directly enters the blood and bypasses the liver. So, if swallowed, ang disadvantage na kaya hindi pwede yung mga gamot na sublingual isuswallow mo kasi hindi siya ma-activate ng ating gastric juices kasi kailangan hindi sila makabypass talaga sila sa liver. So again, sublingual po is sa ilalim po ng ating dila. And then buccal on the cheeks. Okay, sa cheek area doon natin ilalagay. And then hintay natin matunaw doon. And then we have also rectal from the word rectum. Okay, sa puwet. This can be used when drug has objectionable objectionable taste or odor. Drug released at slow or steady rate and provides a local therapeutic effect. We have also vaginal. It provides a local effect. Okay, we have topical, meaning dito sa ating skin. Okay, it has few side effects. We have transdermal. Yan po yung mga patch na dinidikit. Okay, prolonged systemic effect and few side effects and avoids GI absorption and problems. One set of drug action faster than oral. And we have also subcutaneous. The absorption is slower, an advantage for insulin and heparin administration. So usually po, ang pagbibigay natin ng insulin at heparin is through subcutaneous kasi hindi po natin gusto na abrupt yung pag-effect ng ating insulin and heparin. Okay? Kasi hindi dapat pabigla-bigla yung effect nila sa ating katawan. We have also intramuscular. This can administer larger volume than the subcutaneous and the drug is rapidly absorbed, meaning sa loob po ng ating muscles. Pwedeng sa deltoid, pwedeng sa gluteal, ventrogluteal, dorsogluteal, sa vastus lateralis. And then we have also intradermal. Absorption is very low kasi nga dito lang po tayo sa ating skin, sa layer ng dermis. Okay? It is used usually for testing allergies. Hindi po natin ginagamit siya pag bibigay ng medication. Again, ginagamit po siya pag nagkakaroon tayo ng skin testing. We have also intravenous. Syempre, doon na pinapadaan sa ating veins. This has the rapid effect kasi nga direct to the vein and then direct na siya sa ating circulation. And we have also inhalation. That is yung mga katulad sa ating inhaler. Okay, yung mga ano to, Yung mga salbutamol, yan siya. Ventolin, it introduces drug throughout the respiratory tract, and it has a rapid localized relief, and the drug can be administered to unconscious patient or unconscious client. Again, yun po ang iba't ibang routes of administration. You can read the disadvantages of this each routes if you can and also you can search on it naman din. Okay? And then, ito po yung mga practice guidelines pag-administer ng medications, which is yun na po din yung, na-discuss kanina. Pero isa-isahin pa rin natin, no? So, nurses who administer medications are responsible for their action. That is why, if we need to document it, okay, kung ano ba man yung may pagkakamali natin, tayo po yung may responsibilidad doon. Be knowledgeable about the medication you administer. That is why I really advise students, okay, when you go to hospital, okay, kailangan may alam kayo. Okay, sasabihin naman kasi sa inyo, okay, you will be exposed to this area. Medicine tayo. So, ano yung mga usually na cases? Sasabihin naman sa inyo okay, pwede nyo ma-counter, ganito yung mga sakit niya. May BP, may mga problem sa BP, okay, or nagtatae, ganito, ganyan. So, you research on it. Kasi sa ngayon, ang daming resources. You have internet. And please do use that kind of advantage. Kasi during my time when I was a student, hindi pa masyadong laganap yung pag-use ng internet. Kasi nga, we're not really lucky enough to have our own computer, to have our own laptops during that time, and then to have our Android phones na, okay, gusto mo lang mag-Google, ganun na talaga, di ba? Ang hirap. Okay, pupunta ka pa sa internet cafe, magbabayad ka, and then tsaka ka makaka-research. Usually, yung ginagamit lang talaga namin is books. Okay? Nakasalalay kami sa books. So, dapat kayo din, you need to use that kind of advantage that ngayon is very techy na siya, hindi na kayo mahihirapan. So, kailangan, before pupunta ka talaga kayo sa hospital, at kahit anong setup, before talaga kayo papasok sa school, before kayo magkakaroon ng class, dapat, lagyan niyo muna ng utak, laman yung utak ninyo before going to school. Sasabihin nyo, ma'am, kasi ganito kanyan, di ba dapat kayo yung nagtuturo? Hindi. Okay? Kailangan may idea pa rin kayo. Kasi, hindi nyo alam na baka what if, bigla na lang mag-ask ng question yung inyong teacher, mabigay ng oral na pabigla-bigla or quiz. So, nakakaya naman, di ba, kung wala kayong alam. So, kailangan, lagyan natin ng laman or common sense ang ating utak para naman meron tayong alam kahit kokonte. Okay? Then, federal laws govern the use of narcotics and barbiturates. So, hindi po pwedeng, pag yung pasyente ninyo is very addicted na po sa mga narcotics, okay, mga barbiturates, hindi po natin sila pwedeng bigyan ulit. Okay? Keep these medications in a locked place para hindi siya basta-basta nakukuha. And then, use only medications that are in clearly labeled container. Pag hindi po, pag basa-basa na yung container ninyo, do not use discarded. Isipin ninyo na hindi na siya sterile. Okay? Do not use liquid medications that are cloudy or have changed color. Calculate drug doses accurately if you are uncertain. Ask another nurse to double check your calculations. Administer only medications personally prepared. Kung hindi po pinprepare, kung hindi mo pinprepare, yung kasama mo yung na-prepare, siya yung magbigay. Before administering a medication, identify the client correctly using the appropriate means of identification. Do not leave medications at the bedside with certain exemptions, okay? Hindi po pwede basta-basta. Except lang sa mga gamot na pwedeng nasa bedside kung kailangan ng doctor din na nasa bedside. Usually, yung mga doctor, sasabihin naman din talaga nila, okay, pwedeng ipakilagay sa bedside yung ganitong mga medications para anytime sa kanila kukunin. Okay? And then, if a client vomits after taking an oral medication, report this to the nurse in charge or primary care provider or both. Okay? So, make sure na i-vomit niya, na kanya, and then, sabihin mo sa primary nurse, and then bibigyan niyo ulit para to make sure na meron talagang nakuha siyang gamot. Okay? Most hospital policies require new orders from the primary care provider for a client's post-surgery care. When a medication is submitted for any reason, record the fact together with the reason. When a medication error is made, report it immediately to the nurse in charge, primary care provider, or both. And lastly, always check a medication's expiration date. Pag expired, i-discard na natin, hindi na po natin ibibigay. So what are the types of medication orders? Okay, there are 4 types of medication orders that are commonly used in hospitals. We have stat order, a single order or a one-time order, the standing order, and a PRN order or as needed order. So isa-isahin muna natin. Pag sabihin nating stat order, it indicates that the medication is to be given immediately and only once. Again, it is, pag sabihin natin stat, immediate yan siya, pero once lang siya, okay? So, example, morphine sulfate, 10 milligrams, IV stat. Okay, pag sabihin naman natin single order or one-time order, it is for medication to be given once at a specific time. So, specified time. So, example lang natin, okay, at 10 a.m., pakibigyan po siya ng insulin. And then, that is standing order. So, yan lang yung once lang siyang ibibigay. And then next, that is single order. Pag sabihin naman nating standing order, this may have or may not have a termination date. A standing order may be carried out indefinitely, okay, until an order is written to cancel it, or it may be carried for a specific or specified number of days. In some agencies, standing orders are automatically canceled after a specified number of days and must be reordered. Pag sabihin natin standing, dyan lang siya, waiting lang siya hanggang saan siya magta-times up. And then lastly is the PRN order or as needed order. Ito yung mga gamot na binibigay natin pag kailangan ng ating patient. This permits the nurse to give a medication when, in the nurse judgment, the client requires it. Example lang natin yung mga usual na PRN is paracetamol, insulin. Pag alam nyo, makita nyo, mataas yung temperature ng aking patient. Okay, ganito, ganyan. Mataas na naman, ganito, 140. So, bibigay ako ng insulin. So, the nurse must use good judgment about when the medication is needed and when can it be safely administered. Again, yun po yung 4 na types of medication orders. Stat order, single order, standing order, and a PRN or as needed order. So, what are the essential parts of a medication order? So, we have here the full name of the client, the date and time of the order is written, name of the drug to be administered, the dosage, the frequency of administration, the route of administration, and the signature of the person writing the order. Again, yun po yung kailangan na parte ng ating drug order. Okay? So now let's talk about the preparing injectable medication. So, injectable medications can be prepared by withdrawing medication from an ampule. Ito po yung itsura ng ating ampule. So, bottle yan siya and it can be easily break, okay, or broke. And we have the vials. Yan po yan siya. It has pressure. That's why pag kukuha ka dyan ng medication, may hangin na makukuha ka talaga kasi it is pressurized, okay? So, using pre-filled syringes or by using needless injection systems. Okay, pag sabihin nating ampule, it is a glass container usually designed to hold the single dose of a drug. It is made of clear glass and has a distinctive shape with a constricted neck. An ampule's varying size from 1 to 10 ml or more. Most ampule necks have colored marks around them indicating where they pre-scored for easy opening. To access the medication in an ampule, the ampule must be broken at its constricted neck. Traditionally, files have been used to score the ampule. Today, plastic ampule openers are available that prevent injury from broken glass. The device consists of a plastic cap that fits over the top of an ampule. The head of an ampule, when broken, remains inside the cap and is placed into a sharp container. If an ampule opener is not available, the nurse can clean the ampule neck with an alcohol swab and using a dry sterile gauze and snap off the top of the ampule. Once the ampule is broken, the fluid is aspirated into a syringe using filter needle or filter straw. Okay?
Hi
So, yan
friends!
po yung
So
proper
in
na
this
pag-use
video,
or
I'll show
pag-break
you a
ng ampule.
tutorial on how you will manually
Okay,
break
so
your
ayan po
ampule
yung dot. So,
if
dapat yung
you're
dot
not
is
having any
away
ampule
po sa
breaker
inyo,
in your
no?
ward, just
Yan.
like in mine. So you can manually break it. If you see a marking, a white dot, it should be
Okay.
away from you.
So,
And
dapat
then
away yung
just
dot sa
snap
inyo,
it.
hindi pa-facing sa inyo. So, yan. So, diba? It's really easy to break an ampule.
If If it's still
So, you
difficult to
need to
do
click the
so,
top. So,
or
make
if
sure
you're
yung
afraid
nasa,
to
yung
do
tubig
that,
sa
you
or
can grab
medication
a
sa
piece of
taas is
clothing,
bababa yan siya. Para hindi
piece
natin
of
masayang
clothing,
yung
piece of paper, just like
medication.
this.
So, pwede din
Cover the
gamitin
head
natin yung
part, and if
cover,
there's
okay,
a
ng
marking,
ating,
it should be
ano to,
away
yung
from you.
plastic ng ating syringe.
Snap,
Okay? So, do not
just like
hold
this.
too much pressure sa pag-hold ng body ng ampule kasi baka pwedeng ma-break natin yung whole ampule. Okay?
And
So,
another
yung
way
kanina
is,
pinakita
if
niya
you're
is
having
gumamit siya
difficulty,
ng plastic cover
you
nung
can
ating or
grab
pinaglalagyan
the
ng syringe.
syringe,
Okay.
put the head
Ngayon
of the
naman,
ampule here.
ano to, pwede naman natin gamitin yung
This
instead
is
of
for
yun,
any
pwede
ampule
natin
that is
gamitin
very
is the
difficult to grab.
sterile gauze. So, meron din tayong another
To
technique yan.
firmly
Okay. So,
bend it
pag kaya,
away from
sige
you,
go. Pag
and
hindi
then
kaya, wag gawin. Kung saan ka komportable. Kasi medyo mahirap yan siya kasi hindi mo
ta-da!
nga siya
That's it.
mahawakan ng
It's
maayos.
so safe.
Yan.
This is the
So,
safest way
pag
to
ano
do
to,
so,
para
so
safe
you will
din, no?
not
Para
have
hindi din
any
tayo
injury in
agad-agad
your
mahawakan
hands.
yung
That is it,
um,
guys. Hope you like this
ano to,
video and subscribe to
medication
the
or yung
channels.
ulo niya.
I can see you in
Yan.
the next video.
So,
Bye!
may mga ampules din na mahirap i-break, pero pag ganun, we need to use the assistive device.
Hi, friend.
Okay? So, next, preparing medications from ampules. Okay? Pag ganun, okay,
Hi.
na-break mo na yan siya, na-open mo na yan, and then, i-withdraw na agad. So, place the ampule on a flat surface, and then, attach the filter needle or straw. Ganito po yun ha. Yung gagamitin nyo na needle, okay, na pang-inject, hindi po yun yung gagamitin natin. We need to use another needle kung saan yun yung gagamitin natin pag-withdraw ng medication. Bakit? The rationale, the filter needle or straw prevents glass particles from being withdrawn with the medication. So remove the cup from the filter needle and reinsert the needle into the center of the ampule. Do not touch the rim of the ampule with the needle tip or shaft. Rationally, this will keep the needle sterile and withdraw the amount of the drug required for the dosage. So, ano to, makikita nyo dito, di ba, tinaas niya. Make sure na, kasi usually, may mga ganyang ampule na pwede yan gawin pag make sure ka na hindi mahuhulog yung gamot, no? Pwede naman din naka-side lang siya, nakatagilid. Example lang natin, ito yung kamay mo, okay, dito yung kamay mo, and then andito yung ampule naka-side, no? Basta in your eye level. Make sure lang na walang magda-drop. Pwede din to, safe din to actually yung nalagay sa table para at least hindi ka mahirapan, naka-side lang siya. And then, yun na nga po, wag nating itatouch yung ating ampule with the needle. And then for the vial, a vial is a small glass bottle with a sealed rubber cup, and vials come in a different sizes from single-use vials to multiple dose vials. They usually have a metal or plastic cup that covers the rubber seal and must be removed to access the medication. To access the medication in a vial, the vial must be pierced with a needle. In addition, air must be injected to the vial. Again, air must be injected to a vial before the medication can be withdrawn. So, example, ang ibibigay mo is 5 ml. Mag-inject ka muna ng air doon, okay? So, pull the plunger of the syringe, magkuha ka ng 5 ml na hangin lang, okay? And then, ipasok mo doon sa vial, and then, i-flip over mo yung vial, mapapadali na yung pag-withdraw mo ng medication. So, failure to inject air before withdrawing the medication leaves a vacuum within a vial that makes withdrawal difficult. A single-use vial contains only one dose of medication and should only be used once. In contrast, a multi-dose vial is a bottle of liquid medication that contains more than one dose such as insulin or vaccination vial. So ito po yung reconstitute ng medication, okay, powdered medication.
I will begin by gathering my supplies. For this procedure, I would need the medication that is ordered, a diluent, in this case normal saline, I will begin by gathering my supplies. For this procedure, I would need the medication that is ordered, a diluent, in this case normal saline, a syringe, needle, patient labels, alcohol preps, a sharps container, and a trash container. The medication is in powdered form. I need to reconstitute it in order to draw it up. The patient has been ordered to receive 500 milligrams of the medication. I will look at the column on the vial of the strength of the prepared solution, noting that my patient is to receive 500 milligrams per ml. The amount of diluent to be added is 5.6 mLs of normal saline to the vial, which would give me a prepared reconstituted solution of 6 mLs of fluid. That will give me a final concentration of 500 milligrams per ml. I will attach the needle to the syringe. I will swipe the vial with an alcohol prep. I will withdraw 5.6 mLs of normal saline for reconstitution. I will remove the flip cap. As long as I do not touch the top of the vial, I do not need to swipe it with alcohol. Now I will inject the diluent into the powder. I want to gently agitate the vial so that all of the medication has dissolved in the diluent. Now the medication is completely dissolved. Now I will draw up the dose of 500 milligrams, which is 1 ml. I will pull the plunger back to the 1 ml marking on the syringe. I will inject the air. Now I will passively recap the needle. I will label my syringe using a patient label on which I have written the drug, the dose, and the route.
Okay, so I hope very clear yung video na pinakita sa inyo, no? And how to prepare medications from vial. So, again, if you withdraw the medication, you need to attach it to a filter needle as agency practice dictates to draw up pre-mixed liquid medication from multi-dose vials. Okay? And then, ito po yung proper, ensure the needle is firmly attached to the syringe. Carefully insert the needle into the upright vial through the center or of the rubber cup, and then inject the air into the vial. 'Di ba nakita nyo 'di ba sa video na nag-inject muna siya ng air, okay, before siya withdraw ng kanyang medication, and then withdraw the prescribed amount. So it's either you need to hold the vial down or pwede yung ginawa niya na invert mo lang siya slightly on the side. And then hold the syringe and vial at the eye level to determine the correct dosage. And then when the correct volume of medication plus a little more is obtained, withdraw the needle from the vial and replace the cap over the needle. Okay, so using the scoop method, hindi po natin pwedeng hawakan yung cup. Okay, and then insert mo. What if magkurog-kurog yung kamay mo and then magkamali matusok mo yung kamay mo? Okay, so if necessary, tap the syringe barrel to dislodge any air bubbles. Okay, kailangan po natin masigurado na yung syringe ay wala pong lamang na mga airs kasi pwede yun siyang maka-cause ng problem sa dextrose ng ating patient. If giving an injection, replace the filter needle if used with a regular or safety needle. Okay? So next, let's discuss naman yung mga methods of calculating dosages. So there are four more common formulas that are used to calculate drug dosages, and any of the formula can be used. So nursing students are encouraged to review this all to use the method that works best for them. It is important to use one method consistently to avoid confusion in calculations and thus promote client safety. When calculating drug dosages, there are times when the nurse may need to round numbers. So ito yung pinaka-basic natin, in which the D stands for desired dose, or this dose ordered by the physician, and then H is the stock on hand, okay, the dose on the hand, and then V is the vehicle or the liquid form in which the drug comes, such as tablet or liquid. So example lang natin, ito, meron order, erythromycin 500 milligram. Ang nasa stock on hand ninyo is 250 milligram in 5 ml. So meaning, dito yung D natin, i-divide natin siya to 500 milligram, and then ita-times natin siya kasi ito yung stock on hand, okay, ito yung doctor's order, and then ito yung stock on hand. I-divide natin sila, i-times natin sa 5, we have here 10 ml. So, ang i-withdraw po natin is 10 ml na medication just to make sure na ang naibigay natin is 500 milligram. So, parang isipin nyo natin, di ba? 250 milligram, i-divide mo yan siya sa 500 milligram, that is 2. Itong 5, i-times natin sa 2, automatic, magkakaroon na tayo ng 10 ml. So, alam nyo na okay, ang bigay ko sa kanya na gamot is 10 ml. So, yun yung ating basic formula. For the ampule, we need to administer, example, administer 2 milligram the Centron ampule every 8 hours. So, ayan siya. Ang nasa ampule is, ang stock on hand is 4 milligrams. Okay. So, ayan siya. So, 4 milligrams, the desired dose is 2 milligrams, and then the volume is 2 ml kasi nakalagay dito is 4 milligram per 2 ml. So, 2 milligrams divided by 4 ml times 2. So, it's 0.5, meaning 1 ml lang po ang tatanggalin natin dito kasi, that will be equivalent of 2 milligrams. So, isipin din natin, tinan nyo ha, meaning ito 2 milligram. I mean 2 ml. And then 4 milligram siya. So i-divide natin yung 4 divided by 2 para mas madali, 'di ba? 4 divided by 2, that is 2. So meaning ang laman nito, okay, is 2 milligram to 1 ml. So kukunin mo lang dyan is 1 ml, meron ka ng 2 milligram. So may mga times na pag tingnan mo lang, okay, you don't need to calculate, isipin mo na lang kung ganun yung mga case. And then next, we have here ampule of metoclopramide. Ito siya, sample lang natin. Meaning, isang ampule is 2 mg, meron siyang 10 mg. So, ayan siya, 10 mg. Ang order sa kanya is 10 mg na metoclopramide times, meaning 2 ml. Okay, 2 ml po yan siya. So, lahat ng laman ng ampule, ibibigay po natin. Okay, so yan yung mga examples lang. Pag sa vial naman, ito po, okay, we need to check for the diluent. Okay, example lang natin itong omeprazole. Ang diluent po niya is 10 ml. So, 40 mg per 10 ml. Okay, so sa 10 ml na yon meron kang 40 mg. Ang order ng pasyente is, ang order sa kanya is 1 gram. So, that is, typographical error, omeprazole. So, 20 divided by, this is 20 milligram. Okay, hindi ko na na-edit, no? So, 20 milligram ng omeprazole ang kailangan niya. So, ang stock on hand niya is 40 per 10 na diluent. So, kukunin natin dito is 5 ml lang kasi that will contain your So, di ba, naisip niyo, 5 ml, kasi automatic 40 milligram, 10 ml na siya. So, i-divide natin yung 40 into 2 kasi kailangan natin ng 20 milligram. So, makakuha ka ng 5 ml lang. So, example din, we have here 250 milligram ampicillin. So, ayan siya. Okay. So, kailangan alamin natin ilan yung diluent niya. So, may mga case, pag powdered talaga, we need to check for the diluent. Okay, yung kanyang tubig kung para matunaw. So, adding medications to intravenous fluid containers, large volume infusions, mixing a medication into a large volume container is the safest and easiest way to administer drug intravenously. So, may mga times na pinapa-reconstitute natin with the dextrose na para hindi na tayo nahirapan, pero may mga times din na binibigay natin direct sa IV tube. So, the drugs that are diluted in volumes 200, 250, 500, or 1,000 ml of compatible fluids. It may be necessary to consult a pharmacist to confirm compatibility. Fluids such as IV, normal saline, or Ringer's lactate are frequently used, and commonly added drugs are potassium chloride and vitamins. Kasi po, hindi po natin pwedeng ibigay direct through the IV tube ang ating potassium chloride kasi yan po ay nakakamatay ng pasyente. Again, hindi po natin ibibigay ang potassium chloride na direct po sa veins ng ating pasyente kasi pwede po siyang magkakos ng mamatay ang ating patient. So, ito naman po yung administration of intravenous IV fluids using IV push. Okay, so the IV is locked with needle. So clean the injection port with an antiseptic swab and then insert the needle of the syringe containing the normal saline through the injection port of an IV lock and aspirate the blood, and then flush the lock by injecting 1 ml of saline slowly, and then observe the area for IV catheter for puffiness or swelling. So this can indicates that so make sure na pag magbibigay ka ng medication, okay, i-check mo talaga if mayroong mga infiltrations na nangyayari dyan. Bigla na lang lalaki yan. So meaning hindi na patent yung kukunin ninyo, okay, o yung daanan. So, tatanggalin mo yan siya and then rechange the area. Okay? So, yan ang pagbigay ng IV push. Okay? Ito po yung IV push. Ito po yung itsura niya, no? Okay? Hindi siya katulad ng ating dextrose. Okay? So, that ends my discussion for medication. On the next video, may part 2 po tayo dito kasi medyo umabot na tayo ng 1 hour and mahirapan ako mag-upload ng video na to. Ang ating part 2 will be about the IV fluids and also the documentation, the nurse's notes. So, thank you for watching this video and I hope you have understood the topics that I have discussed. If you have questions, clarifications, you may comment down, okay, in this video link para alam ko kung if mayroon kayong hindi naintindihan sa mga topics na discuss ko. So, thank you. And then, please do watch the another video, okay, para at least panood nyo naman din yung ating IV fluids and the discussion on nurses' notes. So, thank you.